Okay. Sorry about the delayed response. Was having some technical difficulties here, but glad to get started with everyone. And I'm going to take off my sweater here, so it'll be a little bit a little better equipped, even more so, to answer any questions people have. Um, and I did this about 3 weeks ago, I guess, was the last time I was here and able to join everyone. So it was shortly into the new year, really fresh into the new year, and glad to be here again. So just to introduce myself, I'm Dr. Jesse Spiegel. I'm a licensed clinical psychologist in Los Angeles, California. I work in private practice. And I work with both kids, teenagers, and adults with OCD and related disorders. I also happen to treat anxiety, depression, and insomnia. Those are another big um, components of things that I do. I'm also a clinical instructor in the Department of Psychiatry and Biobehavioral Sciences at the David Geffen School of Medicine at UCLA. And I've had a lot of extensive training in treating OCD and anxiety disorders. And again, having mentioned working with kids, I've also done the SPACE program led by Dr. Ellie Leibowitz of supporting parents for anxious children emotions, and the IOCDF's BTTI training. And I've led a lot of trainings as well for both clinicians and individuals with OCD. And I happen to be licensed in both California and New York. And if anyone's also interested, you can check out my website, which is www.drjessespiegel.com. So www.drjessespiegel.com. So what we're going to do, I'm going to try to share each question to get it a little bit bigger so we can see it as well. And so let's go ahead and get started. I see someone already seems like they're testing it out. So I'm going to do the first one, which we should now be able to see. And thank you, Lainey, for your question. How can I help my teen do just basic tasks when it's so hard for her? She's usually frozen in intrusive thoughts. How can she do ERP but can't apply it to regular life? Well, one thing that I would wonder is this experience that you're having with your daughter, is that around the clock, where she's not able to complete the tasks, or is it when she's really overwhelmed with her OCD? So if it's when she's very, very overwhelmed with her OCD, yeah, that may not be the best time. But if this struggling, if you're able to kind of work with her at a different time when she's more put together, isn't as overwhelmed or stressed, that may be kind of where you can brainstorm on how to handle these types of situations. When the iron is really hot, that may not be the best time to kind of attack everything. So let's go ahead. We're going to go to the next question. And, I want to say, obviously, the advice, the feedback that I'm giving right now does not substitute for therapy, but I'm going to try to do my best to give, answer questions in a way that provides some guidance, some headway for everyone. Okay. Babes, and I may be again saying your YouTube name not exactly right, but hi, I have severe health anxiety and just started in therapy. What are some good tips to ground myself when anxiety spikes from physical sensations, dizziness, nausea, and depersonalization? Well, overall, I'd say this is going to be, again, something good to talk to your therapist about. When you do, this is something for especially that people with OCD treatment are very familiar with. When you do exposures and you're purposely facing your fear, you do not want to do strategies that are meant to immediately bring down the anxiety. You want to more bring upon the distress, and so proving that you can handle it, and also seeing that your fear will eventually, after time, habituate ideally, or at the very least, you learn that you can handle it. As far as kind of grounding techniques like meditation and so forth, they can be very useful for kind of setting the right framework for yourself for the day. Another thing that can be done too, as far as, identifying reasons why you're doing what you're doing. So knowing, like in the case of where you may get nauseous and so forth, you could put little sticky notes, again, reminding yourself, I'm embracing this fear. I'm doing these things that are hard because I want to get better. Again, things that, you might find useful in increasing your willingness to do the tough work. Okay. And then last time, by the way, when I answered the questions, I'm new to this kind of format with the YouTube. I think I got the bulk of the questions. Obviously, there was a limit in time. We're going to go till like about for 50 minutes, so a little before 6. But in case if I don't get everyone's time or I miss any questions, it's because I'm trying to navigate this YouTube experience. So I appreciate the flexibility that everyone hopefully is having with me. And obviously, I can't see anyone's face, so I'm going to just assume the best. Okay. Melinda Weiss, how do I become a functional person when everything seems so overwhelming? I feel like I'm destroying my life and relationships. You know, I would say when you're really, really getting hit hard by the obsessions and people are finding themselves really engaging in a lot of compulsive behavior, it can feel as if everything is falling apart, everything is crumbling. And so, Melinda, appreciate kind of your honesty in how it's really impacting your life. What I would say is like a big thing to remind yourself is this is a process. So the idea of doing exposures and really facing your fears, this takes time, and to kind of have that sense of compassion for yourself. Um, so it's sometimes why I'm sometimes a little bit personally in practice mindful of giving people like a specific framework of how long it will take. You'll get better in 3 months. It really depends, but you're taking steps. So for me, when working with a lot of clients, I will help identify all the compulsions that are going on, the amount of time it's impacting them and so forth. And this also then creates like a framework where we're able to see progress, we're able to measure success. So as far as relationships are concerned in your life, it may take time to make that progress, but you can see slow inroads and to just have some patience for yourself. All right. JP, that's definitely an easier name for me to pronounce. Hi, my theme is mainly focused on SOOCD. I'm attracted to trans women, and I know the debate, but my OCD make me want to pick an orientation, and I get okay for a while, and then it starts. So what JP seems to be talking about is sexual orientation OCD, and sometimes it could get confusing with abbreviations and so forth. But a sexual orientation OCD is basically when you have someone who, let's say, if they identify as heterosexual, and this is just part of how they see themselves, and suddenly an intrusive fear comes up, and that they're, what if I'm gay, and what if I've actually been living the wrong life, and it's that intrusive thought can be very overwhelming. And likewise, that can also happen for someone who identifies as gay, and then suddenly they get an obtrusive thought, oh my goodness, what if I actually am attracted to someone of the opposite sex? And so again, these thoughts can be very overwhelming. And the part as far as kind of treatment is concerned is it's really just learning to live with the uncertainty of some of having these thoughts. Just because you have a thought doesn't mean you are the other, orientation and so forth. It's just learning to kind of accept the thoughts and as they come up. Okay. I notice, and Starboy Clem, who has a photo of Tupac also, it seems like. I noticed that when I get an OCD episode, I start looking at OCD treatment videos from experts and generally enter the OCD community. This makes me feel better and hopeful, but I believe it's a compulsion. So actually, what I really want to applaud Starboy, who is also a fan of Tupac, is this ability to actually recognize why you're doing what you're doing. What is the function of this behavior? And that is a very, very important piece. Yes, that is correct. If, for instance, whenever you're having anxiety or distress from your OCD, so let's again say you have obsessional thoughts that come up, that you could harm someone, and it's very overwhelming from you, and you get immediate sensation. And now, lo and behold, you go and check out things on the internet, or you look things up in the internet community. That would be function as a compulsion. You're doing this to remove that immediate distress. So that's what you want to avoid. Now, I don't want to take away that it's not helpful to have a community and resources. You just want to be mindful to not be specifically doing something with the idea of removing distress. And by the way, I also see that there seems like the second part of the question. And again, I'm trying to read these questions on the spot. So if you have like two posts, I may miss it, and it should. So the second part of Starboy's question is, and should I stay away from anything related to OCD and deal with it on my own? Am I right that it's a compulsion? Yes, you are correct again. But I don't think it's bad to have a community and to have information and so forth. You just want to be mindful. When am I gaining this information? Is it going to be important for my process, for my learning, and so forth? And when is it functioning as a compulsion? So perhaps it is about limiting the amount of time that you're researching, that you're needing to specifically do the community, and also being mindful of not doing it to remove any anxiety and distress, and that the function is maybe more to just gather information. How do I deal, and Angela asks, how do I deal with the difference between a real spiritual issue and scrupulosity? That is a tough question. And it's also not an easy question to just, answer, obviously, on, through a quick response here. The reality is, and Angela's question that she brings up, it does very much relate to spirituality. Can bring up a lot of questions that you have on like what you accept, what is meaningful to you, and that's a normal process to have, to question, to wonder. And when is it at the same time? When is it scrupulosity? I would say it's scrupulosity from an OCD standpoint if you're constantly needing to engage in a specific behavior to answer yes or no with definitiveness. And I'm aware some people who are religious may kind of view things in a more black and white standpoint, but I would say it doesn't necessarily bring a constant distress. If it's bringing constant distress and you're needing to answer yes, no, you're engaging in that mental debate, that may be where it's leaning a little bit towards like an obsessional standpoint. If it's kind of things that you ponder at various points of the day, maybe in one day and another point of the day, but it doesn't have that same intensity, that may be where it's a general spirituality concept. Again, the whole part of OCD is a doubting disease, so it's going to leave you really like stuck in trying to answer things yes or no. Okay. And also, by the way, I'm happy if like we do go through all questions to try to maybe just give some more information on OCD and so forth. I know I just jumped straight into our broadcast today. Okay. So, and I think maybe this is actually related to, it looks like it is related to JP's earlier question. I don't fit neatly into a category, but OCD kicks in. I'm just going to maybe speak broadly to this concept of a category for OCD. There are lots of just categories within OCD. You have there's new ones constantly coming up. You have sexual orientation OCD, you have relationship OCD, and some of these kind of fit within the same category. You have harm OCD, you have contamination. Um, Even within the harm, there's some like suicidal obsessions. Uh, Again, harm obsessions towards others. That there's existential OCD. There's lots of different categories in general with OCD. And so even in something like this, at the end of the day, OCD, if I were to summarize it for someone, yes, there is a framework and it maybe relates more to, whatever obsessional category you're coming up with. But the bottom line with OCD, the treatment is still the same throughout with exposure response prevention. It's about moving more towards uncertainty and ideally having exposures to purposely face those fears and breaking that compulsive behavior. So at the end of the day, treatment is still the same regardless of what category, what subcategory you have, is that it's still about moving towards that uncertainty and being able to kind of move forward. If One thing that I talk about regularly with clients where people do take risks are every day you get into the car, let's say you have to go to work or to do errands, you are taking a risk. There's an insane amount of driving accidents, yet this is a risk that people will inherently take on, and they repeatedly do this, and they don't really give it much thought. And I will likewise tell you, people will pick up the sponge, wash their dishes, in many cases wash those dishes and use the same sponge for 3 months. Probably not something I'd necessarily advise, but the idea is, that you could definitely, that brings some contamination. But the idea is you take in that uncertainty, you get in the car and so forth. When you have OCD, it's this 100% needing to make sure you're not that 1 in a million case where you're going to get hurt, something bad is going to happen. And so the work really is, again, about embracing that uncertainty, moving more towards it, which is honestly part of life in general. And even if you think about it, with the pandemic, we could have never predicted that. And here we are. And so it's about always learning about how to handle uncertainty. Okay. Lean, or maybe it's Leanne, says, my OCD has caused me to develop severe apathy towards everyone and everything I've ever loved. I can't feel anything. I just sleep all day, and I just had my first child, so I feel even worse. Any advice? Uh, this is a question where I would, you know, sometimes OCD can overlap with other things. And I want to be mindful. When I'm answering these questions, I cannot give a complete formulation of difficulties and so forth if there may be other things going on. But just because someone has OCD does not mean that there may not be other issues that are coming up. So, for instance, someone with OCD could also have depression that comes up, and in that case, if you're finding yourself fatigued, lack of energy, hopelessness, it is possible, again, and I'm not going to speak with definitiveness, especially in answering a kind of a brief question to here, but that depression is coming up. So I always think it's very important to reach out for professional help when needed. And NoCD has a fantastic community, and there's other communities out there too. But basically, no matter what, if you have OCD, you want to make sure you're meeting with an expert who treats that, and also who works with who's able to work with other things that come up, because that is a normal part of life. And so just to get the support that you need for the moment. Okay. Amber, how do you practice self-care as a clinician who is constantly exposed to intrusive thoughts of others? Amber, great question. It's funny is I would say probably a lot of clinicians, um, struggle with this. I think especially during, the pandemic, their therapists, I mean, along with medical professionals, were very burnt out from the amount of work that they were doing, and OCD work can be a bit intensive. And I also don't know if when in asking that question, that you yourself are a clinician, but it is, yeah, self-care is important. um uh, you know I would say this is true for people who have OCD too, but it's important that this is not your only work, and the only thing that you're living, breathing, and eating, and so forth. So, as far as self care for myself, I try to work out. I spend some time with family, and if I as far as getting support groups where you have like other clinicians to talk to about who you have, if you have any distress with. I happen to be the co-vice chair of the Anxiety Depression Association of America, ADAA, their OCD SIG. And in this vice co-chair role, we will have time for, and these are all other clinicians who are working with people who have OCD, whether it's children, whether it's adults, and we will sometimes have some spend some time to talk about stress that we're feeling from our cases, and how to support one another. Good question. Okay, and this next question, Priyanka asks, feels great discomfort and anxiety when someone talks negatively and says something negative, and therefore unable to socialize thoughts and feelings, keeps coming on for days and weeks. Help. Um, so, uh, as far as this is concerned, it seems like the person here is feeling a bit overwhelmed from a lot of negativity that they're experiencing, and I'm not sure. In this case, it could be related to OCD. It could just be maybe these things are triggering the obsessional thoughts. I would say again, if you're feeling yourself really struggling, it is a good time to just seek professional help, and there's nothing wrong with that. Your therapist, your clinician, they can help guide you, so you're getting the help you need. You're also being able to move in the right direction towards feeling like you have a better sense of being able to move forward in a positive direction. Okay, we are going to continue along. Lizeth. Some of these names I'm like really working on pronouncing here. Is it possible to become hyper aware of everything with OCD, such as people, emotions, etc.? Uh, yes, is the answer to it. If you think about it, taking, let's say, not taking the people emotions and so forth, but you could become, if someone has contamination concerns, they're going to be hypersensitive, they're going to be more alert because their anxiety goes up, that something may be wrong, and so suddenly they're looking for wild, intense ways that contamination could come up. Again, if you think about it, like in other ways, if you are hyper alert that you did something wrong, well, you may be more looking out for ways that you offended people. Again, that may not necessarily fit specific within OCD, but it could be a different anxiety disorder too. But the bottom line is, you are going to be more hyper vigilant for issues. And so I'm like moving along in this YouTube. I know I kind of the comments, and I see someone just said hi. So I'm not going to highlight this specific question, but hi back to the person who said that. So, do I have any tips for harm OCD? Is asked by Ellie. Um, there are lots of tips for harm OCD. John Hirschfeld, he's a licensed marriage family therapist. He and a very big expert. He's written He has a book on harm OCD. You should be able to look it up. But there's a lot of mindfulness strategies that he has that would be useful. And I know NoCD has an overview of kind of like ways that harm OCD can come up, some kind of brief ideas of treatment in some of the articles, and trying to think of other resources, but those are a few that kind of quickly come to mind. There's also something on Shepard Pratt. I think that actually that's which is another happens to be another article written by John Hirschfeld. Uh, Going back to harm OCD. So harm OCD, let's say someone has intrusive, unwanted thoughts that they could do some harm to others. And I want to distinguish between this is, different than, let's say, if someone would be homicidal, or if someone wants to actually to do the harm, they see that as part of their identity. They really want to hurt this person, and this is something that they want to do, versus someone who has OCD. They absolutely, 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 absolutely do not want to do this. These are intrusive, unwanted thoughts. So, as far as Ellie, with your question is concerned, in general, it's a similar framework. And I know I mentioned this earlier, but you want to know. So this is, again, what I do as a clinician. I really want to first identify what is going on. What are you currently doing? Whenever you have that distress, what are you doing? What are you not doing to get rid of it? Because then we can come up with a framework of what are the compulsive behaviors. And then that also provides the framework for what is maintaining the issues and what you can do to face your fears. Again, what I would say for some of these questions, I do really think I really want to emphasize it is very important to seek professional support, as far as for facing your fears. And even while I'm making this comments, there are a lot of clinicians who have OCD too. They will still seek professional support and guidance. So, I mean, kind of taking the approach of just, hey, I'm just going to try to do this all on my own. It's a lot. So there's nothing wrong with seeking support. Meg Johnson, can sexual orientation OCD also cause false memories that make you feel like you're actually remembering things? I have memories of things I know happened, but it's making me think I had certain feelings. And this is, I got the second part of the question by clicking it, feelings when these things happen that I don't think I did. So again, what Meg Johnson in the first part of the question, which I'm going to just highlight again, is false memories. And false memory is, if you think about with OCD, OCD is it's, for better lack of terms, it's the doubting disease. It's going to make you doubt everything, that uncertainty and so forth. So again, that could happen regardless of the subtype of OCD. So, for something like sexual orientation, which was the part of the question, it may make you suddenly question, hey, when I had this prior experience, maybe I actually felt a certain way towards this individual. This may be a sign that I'm actually heterosexual, or this may be a sign that I'm gay. Or maybe this happened and I don't actually remember it. That is a natural part of OCD. And if you really think about it, OCD, the big takeaway that I'd want people to have in this Q&A time would be, OCD is all about uncertainty. It is all about needing to know absolutely this cannot happen. And the treatment towards OCD is moving towards that uncertainty and learning, that you can handle it. And that's a big part of what exposures do, and kind of breaking that compulsive behavior. Okay. Stacy Miller, about to start ERP on Saturday. There we go. Stacy, nice. Is there a big correlation between nightmares and OCD? I notice I have really bad dreams every night that focus around the same few scenarios and wonder if ERP helps. If you think about it, that OCD is a very overwhelming concept. Yes, it can definitely tie to nightmares. I've worked with people who had some harm-related obsessions, and actually was also things that were coming up in their nightmares too. So that is a very common thing that can come up, and something that will be ideally worked upon in your treatment. And very excited to hear that you're starting your ERP work on Saturday. Okay, Joe Viviano. Is it common for people with OCD to overthink moral situations? For example, I once supposed that asking a question may cause the listener to suffer a caloric loss, giving them evolutionary advantage. Okay. Yes, you can overthink. OCD is very much an is going to make you doubt things. So, having questions with uncertainty is very common. And as far as this specific uh, question, it's I feel like there may be a little bit more that I need to kind of fully understand it. But what I would just kind of say is it is normal to doubt when you have OCD. Okay, Savannah Roberts. Hi, Dr. Spiegel. When feeling the urge sensation with OCD, what are mindful tools for in that intense moment? Well, as far as the urge sensation, it's a little hard for me to say fully. I'm gonna try to give you an actual tool, but I always still think let's try to get a sense of what is going on right now. What is your compulsive behaviors? Just because you want to know that is to me like the framework of what's maintaining the difficulty. As far as an urge sensation and a specific mindful tool, if I could share my screen, I would, but I'm really concerned I would totally mess up this YouTube, so I'm not going to do that. There is something called a ride. Dr. Aureen Wagner, and this is just an example of one mindful tool that could be helpful. And more, I'd say it's actually about kind of keeping yourself present. Dr. Aureen Wagner uses something. She's written some books as well, and presented a lot. A very big expert on OCD. She uses something called a RIDE acronym, where the letters, and I may butcher this a little bit, but I'm going to do my best. Is you have R, which is recognize it's OCD. So just saying, hey, this is OCD. I, insisting you're in charge. D, doing the opposite. And E, just kind of basically enjoying yourself, rewarding yourself. So again, like kind of doing that thing to keep yourself in the framework of keeping yourself present. Is there anything that you can do that would be the opposite or different? That is something that you can do that would be helpful. Okay. Alex, hi. I'm a new resident physician, and compulsions like rereading lab values, worrying about my patients, whether I wrote their note, and rechecking. Any advice for when the stakes are so high? What I would say here is so Alex has a kind of is a physician, and where he's finding himself um, as a result of his work, rereading patients' notes, um, rereading things and rechecking. And my guess, Alex, based on your question, is it may feel because if I screw up, if I make a mistake, lo and behold, this could be very catastrophic. And that this is, and, in some cases for physicians, it can be more challenging. It can feel a bit more like they're pressure filled. It still relates to that uncertainty and doubt. So, using that as far as like rereading and checking a patient's file, you still really want to limit that compulsive behavior. I would also want to use what is more standard practice for, let's say, other physicians. So some physicians who are colleagues are, let's say they have to read things like 3 times. Okay, then maybe that's standard, but it's still using as a framework. When are you going considerably more than would be considered typical for other people who are in, let's say, in the similar field. And then you want to reduce those compulsive behavior, try to break that compulsive behavior. So maybe it's reading the patient file just once. That would, I would imagine, bring on increased distress. Again, if I misread it at all, or perhaps I will do damage to the patient. But embracing that uncertainty, and that is kind of what is part of kind of moving forward and making progress. Peyton Jenks says or asks, I struggle with a lot of mindful techniques becoming compulsive. Meditations become, if I don't do this, I won't be able to sleep. Or if I panic, or I will panic if I don't, it's hard. As far as meditations and mindful techniques, and it's funny is I actually had this conversation with a patient who I just worked with today. Meditation, I think, is a very good practice. It's a good practice in keeping you grounded, in kind of being able to have some type of balance and so forth. It's fine if, let's say, like, a part of your day is 5 minutes in the morning. I wake up, I, do like a meditation practice. Or after lunch, I go and do some type of meditation. It's just something that I do for myself. I enjoy doing. But when it's that I need to do this immediately, after I become distressed, and I need to do this constantly, or if I need to do this, or if I don't do this, I won't sleep. That's when it can start becoming problematic. And you want to take steps again, I would say ideally with, a clinician, where you're slowly breaking some of those rules that you have. So if I don't do this, I won't be able to sleep. Maybe try to shake it up a little bit, like how if you used to do the meditation technique, switch it up a little bit, like how it's being done. And again, you're not measuring whether you're sleeping or not sleeping as success. You're measuring whether you're able to break those compulsive rules. If you sleep well, fantastic, great. If you did something and it throws it off, but and you didn't panic, great. But the real reality is, are you able to demonstrate increased flexibility? Okay, here we go. Josh Abel, do you have any advice for someone with OCD trying to have a long-lasting relationship with someone who doesn't have it? I feel like I'm dragging my girlfriend into my own OCD, and I don't want to. So, I know I had talked earlier about the different subtypes, and what Josh is talking about is called relationship OCD, and where there's constant doubt with obsessions, if I'm like with the right partner, or maybe there's just constant questions that come up in the relationship. And the challenge is this can sometimes lead to just not only struggles for their own person, but it can also impact the other relationship. And by the way, likewise with Josh's question, it could also just be unrelated to relationship OCD, that someone who has OCD, maybe they have contamination obsessions and they're engaging in all this compulsive behavior. And not only that, their partner needs to engage in, they'll accommodate too, and they'll start doing it. And lo and behold, this is where OCD is not only impacting the person who has OCD, it's impacting the loved ones too. And so in the case that Josh is mentioning, it's about impacting the relationship too. So as far as in general, when I work with people, that is something that I will talk about, whether it's obviously with a child client, it's a lot clearer when they're impacting the family. But let's say you have an adult and they're married, they have kids. Their OCD doesn't just impact them, it often impacts others. So in general, in my work, I will sometimes have like with a patient, I'll have their loved one join a session too. And we'll talk about ways that this person may be struggling, and ways that the family member can be supportive, but not providing reassurance. So, and how to kind of push them forward in ways that may be helpful, but not, again, helping the individual, but not helping their OCD. So if you are working with someone, I think that would be something to ask your clinician to see if that perhaps the loved one could join a session. It's something that, for instance, when I work with people, the other person can find very helpful. Hi, Sharon asks, "Hi, I get episodes where I clean and decorate, and I can't stop Enya." I'm not sure if that's supposed to stand for something else. No, or maybe it was it. Probably more likely it than Enya in Spanish. No sleep for 48 hours. Is that a manic episode? It is very. I want to be mindful. I can't diagnose on a YouTube, and it is always possible that there can be something else going on, that there's another diagnosis. Um, but what I would say is, if you're finding yourself really struggling, I think it's a great time to seek support. And there is really nothing wrong with it. If you think about it. And I'm glad people are really on the YouTube channel right now asking their questions. But if you think about it, if you had if you severely injured your leg, you probably broke your ankle, you broke your leg, you wouldn't just kind of like continue going on. You would need to see a doctor, you would need to go to the hospital and so forth. And if you're finding yourself really struggling, that you're awake for 48 hours because of your need to engage in some compulsive behavior, yeah, it's okay. You should seek support, and there's nothing wrong with that. And then I think the person can ask more thoughtful questions, if any forms, obviously, too, and really give you the diagnosis that you need, and then also get you the right support, whatever that might be. Christopher Pope: I have severe OCD and struggle with social anxiety. How can I help myself get over this so I can function at work? Well, again, I would say seeking out the support that you need, so you have someone can guide you in the right direction, someone who has experience with this, and a professional. Again, you can reach out to NoCD, or there's uh, private practice clinicians. There's also outpatient therapy facilities, but the main thing is, you obviously want to have someone who specializes in exposure based work, CBT, and can help identify uh, uh, what you're currently doing, what's happening exactly, whether these are things that are observable. So like if we take OCD, like observable compulsive behavior, or maybe some mental compulsions too. And likewise, what are you currently doing as or not doing as a result of the social anxiety? So you want to know what's currently going on, and then trying to make certain ways for you to face your fears, and make kind of get that support, get you to kind of move in that direction. All right. And again, I'm trying to knock off these questions. I love them. They're great. How can I more clearly articulate why I struggle with thoughts and patterns? That it's not as easy as just switching how I function. Often, when confronted, it feels like it's impossible to change. So again, how can I feel more clearly articulate when I struggle with thoughts and patterns? That's not as easy as just switching how I function. Or when confronted, it feels like it's impossible to change. Um, again, with questions like this, you want to slowly be doing things that are uncomfortable, and taking that approach towards moving to the distress, and just that's kind of like part of your overall progress. What can I do that will push me towards distress versus show me that I can't handle it? And that would be one way to move forward. Okay. Anthony Greco: how can I communicate to my provider that I need in-person treatment and possibly inpatient treatment? I've been out of work for over 18 months. What I would say here is, it is important, whatever the modality is, that if you're working with your provider, your therapist, it's important that you feel a sense of comfort, and that there's that security that you can talk to them about what's going on. So if you're doing sessions via telehealth and that isn't working for you, well, you should be able to mention that to your provider that you need in-person sessions. And if it's really a struggle, like, I think you want to have these conversations of what your needs are. And I would say likewise, it's important that you should be able to talk about this too with your provider. And for yourself, if you feel like you need something else, you can always change and, to do what is in your interest. Okay. So next question. Hi, my OCD is religious. I feel like if I don't wash my hands, if I don't wash hands again and again, the way we will be eating unpure stuff, or I won't be valid for prayer. I am Muslim. My religion is not hard at all, but what I do, I feel like there's probably more to this question, but we'll stick with this part. Uh, I'm just going to try to answer the question. It seems like there's probably more to it, but uh, OCD treatment is about moving towards handling discomfort and things that are not easy for you. Uh, but at the same time, OCD treatment doesn't involve you flagrantly violating your values. So, for instance, if you are Jewish or Muslim and you don't eat, let's say you don't eat pork, um, exposures wouldn't be set up. So, and this is part of your value system, if you're observant and so forth, it wouldn't be about setting it up. So now you can purposely face your fears and doing those things and eating those foods. So you want to do things that, again, going back to the question, like you want to do do certain things that are uncomfortable. So if there are contamination concerns, you want to be moving towards things that are challenging with the exposures and so forth. But if, let's say, there was something that is inherently not consistent with your religion, I would not go and support and say that you should be doing things to face those fears. Okay, R.O. Tom. If I pass near a child where unfortunately there are no CCTV, I don't know if CCTV, if that stands, I don't think that's cable TV, and this is, I don't know if this is Canadian TV, but in a playground for EG, I think maybe I touched them inappropriately or raped them, then I doubt whether I really did it or not. How to distinguish between my imagination and something. This seems like it's part of the second part of the question. How to distinguish between between my imagination and something which did happen in reality, for example, in harm or pedophilia OCD. Um, uh, I'm trying to kind of fully get this question down, but my understanding based on the question is the person doubting if they did something in general. OCD is a very much, a doubting disease. Again, still always want to emphasize it's important to work with a clinician and a professional and to seek professional support as needed. But in general, OCD, if you're starting to have those intrusive thoughts of like, maybe I did, maybe I didn't, again, think of it as the doubting disease. Gaga POD. Judging from this name, I think this person is probably a Lady Gaga fan. I suffer from just right OCD, and as I do ERP throughout the day, I inevitably do very short compulsions that don't appear as OCD until I do it. Will it become easier to identify OCD as I do ERP? Yes, I think as you start to do exposure work, you're going to get better and better at being able to identify, when you're doing things to remove doubt, uncertainty, and so forth. That's a big thing as far as within the treatment is concerned. Is why am I doing what I'm doing? that, what is the function of in behavioral terms, for people who are cognitive behavioral therapists, they'll ask, what is the function of the behavior? Why am I doing what I'm doing? So if the behavior is to remove distress, it's probably a compulsive behavior. If you're just doing what you're doing because you enjoy it and it gives you meaning, well, then it has a different concept. Okay. How does non-duality meditation differ from exposure therapy? Non-duality meditation. Um, I'm actually not too familiar specifically with non-duality meditation, but speaking to exposure therapy, that's specifically about purposely facing your fears and learning to break compulsive behaviors that come along. And by the way, I'm loving, we're getting more and more questions pop up. Chuck Herring, I have struggled with HOCD my whole adult life, but I thought I was a sex addict and have been in 12-step groups for the last 20 years. Do you think that 12-step programs help or hinder OCD recovery? It's really hard for me to answer the specifics to this question because it seems like there's a lot more to it. But I don't know if it's a pretty personal question or a pretty individualized question. So, OCD treatment is about, exposing yourself to fears and so forth. If you're needing to constantly do a 12-step group to remove distress, then that's probably not helpful. However, at the same time, if you do have some type of addictive behavior, well, then 12-step groups are can be helpful. But again, that this may be something where you'd want to seek, kind of have a professional consultation to get a little bit more. You can provide more information, and you can get more feedback as well. And I'm sorry if in some of these questions I can't fully answer them. Just it's part of the challenges of being able to try to answer a question on a YouTube format with the limited amount of information. Okay. Lily Parker, seeing a new OCD specialist soon, and I've heard horror stories of people with my theme. Real event misdiagnosed as it's less common. In your experience, are more specialists familiar with real event? I'm assuming real event OCD. If you've worked with a qualified clinician in an OCD treatment, they would be able to recognize OCD regardless of the theme and the category. And again, I say this having worked in a partial hospital program beforehand for people with OCD, in private practice, and really seeing various severity levels. OCD, it's really whatever the subtype is, there's still that common theme of uncertainty. So I think a good clinician, obviously uncertainty can relate sometimes in other diagnoses too, but a person who really specializes in treating OCD would be able to recognize it as such and help you out with getting the appropriate treatment. Okay. And I think we're gonna have time for one last question. If I go out of my house, I have a voice recording on my phone so that I have some evidence if I might have harmed someone while walking the street, and I keep on taking photos in my phone, what to do. So it sounds like you're doing all these questions to remove doubt. That evidence that something might happen, you take a recording on your phone. If I might have harmed someone walking the street, I take photos. I would say likewise. I've worked with people, they leave their home, and let's say they get that more of a just right OCD that they need a, oh my God, like I just need to get that feeling about locking their door, and they'll take a photo on their phone that they locked the door. Again, I'm doing this to remove the distress. That is the function of the behavior. In that specific case, it's a compulsive behavior, and you want to learn to break those compulsions. Again, if you think about it, OCD is going to have you do a lot of rules, and it's never ending and so forth, and you want to break those rules. They are not helping you out in the long run. maybe they're helping you out in the short run moving forward, but in the long run, you're stuck and the rules keep adding up. So anyway, I see that there were a lot of questions and a lot more questions, and I'm sorry I'm not going to be able to get through them all. But I really wanted to thank everyone for coming out. This was my second time, and I'm trying, as you know, to figure things out. And with the YouTube, this is my first, second experience now as far as just answering questions on YouTube. I've done other modalities like with Zoom, where I'm able to see people and so forth. But regardless, I thought there was a lot of great questions here. And for those who are struggling, you can always reach out to NoCD, and they can get you in the right direction of what you need for your OCD treatment. And just again, to go for myself, my name is Dr. Jesse Spiegel. I'm a licensed psychologist based in Los Angeles in private practice, and I'm also licensed I'm licensed in California and New York. So I see people in person and via telehealth. But anyway, it was very nice to answer all the questions, and thank you all for coming out.